Hello, I'm Akalat. I'm a student nurse practitioner. I'm going to assess your abdomen and your musculoskeletal. Is that okay? Okay. I'm gonna wash my hand and wear my gloves. And then I'm gonna start from your abdomen. Your abdomen color is consistent to your ethnicity. The contour is flat. There's no scar, striae, or hair. There's no peristalsis or pulsation. Let me see for any bruising. Turner sign and negative. That's my inspection. Now I'm going to do palpation. No, I'm going to do auscultation, sorry. I'm going to start from your lower quadrant, from right lower quadrant. Bowel sound present in all quadrant, normal. I'm gonna listen your arteries on aorta, renal, and ileus. I'm gonna use my bell. Aorta, renal, and ileus artery, no bruits. Now I'm going to percuss, and then I'll start from your lower abdomen. Tympani in all quadrants. Now I'm going to see liver border and spleen for enlargement. So I'm going to start from midline, from mid clavicle, mid clavicle, and I'm gonna see the border. I'm gonna feel the tenderness. Let me see the epidermis here. That's my landmark. I'm gonna start from the bottom to see. Okay, there's no enlargement. It's about 6 centimeters. I'm gonna see your spleen from mid-axillary. It's all tympani, so there's no hepatosplenomegaly. Okay. Now I'm going to see for light palpation. No tenderness, no masses. I'm going to do deep palpation. No tenderness and masses on deep palpation. Now I'm going to see if there's any tenderness around your gallbladder. So I'm going to go to your upper right costal margin. I'm going to do this. Can you take a deep breath? No tenderness? No. Okay, no tenderness. Murphy sign, negative. I'm going to do McBurney sign for your appendix. So here's your umbilicus, and then here's your iliac bone, and between those, I'm going to check McBurney test. Any tenderness? No. No rebound tenderness. McBurney test negative. Okay, now I'm going to check your, can you sit up for a second? I'm going to check for CVA tenderness. Any pain?
No.
CVA, no tenderness. Okay, lay down. So that includes abdominal assessment. Can you sit up and around? I'm gonna check. I'm gonna start from your joint, musculoskeletal. I'll see your joint first. I'll inspect, and then I'm gonna feel your shoulder, your elbow, your wrist, your fingers, your hip, your knee, and then let me see, and then your ankle. Okay, no tenderness, no redness, no edema, no arrhythmia, no crampus or effusion. The joint is good. So I'm gonna check your muscle strength. And can you do this? Okay, pull me. Okay, push me. Okay, good. And then do the same on your leg. Okay. Upper and lower extremities strong bilaterally, and 5 out of 5. Now I'm going to do your cervical spine. Can you look up? Can you look down to your side to side? Can you do this? Okay. Cervical spine, full range of motion. Now I'm going to do shoulder movement. Okay. Can you extend your hand? And then can you do this? Can you, okay, and then inside, and then can you, good, can you touch your finger? And can you do the other side, scratch? Okay. Shoulder, full range of motion, normal apply test, normal scratch tests. Full active range of motion. Now, I'm going to do your elbow and your wrist and your finger. The range of motion. So can you do this? And then can you do this? Down, do this, and then from your wrist, do this, and do this way, and then do the finger, put it together. Okay. That's a full range of motion of elbow, wrist, and finger. I'm gonna check for Herbert's and Bouchard test. There is no nodule or no tenderness. And then while I'm here, I'm gonna check if you have any carpal tunnel problem. Do this for 1 minute. And do you feel any tenderness or do you feel any pain, tingle, numbness?
No.
Okay. Talon test normal. Negative. When I'm here, I'm gonna check your tunnel test. I'm gonna tap your radial nerve and then tell me if you feel any numbness or tingleness or pain.
No.
No? Okay. I'm gonna do this. Okay.
No.
No tenderness. Tunnel test is negative. Okay, and then up there, I'm going to do the hip, lay down again. We'll go up a little bit, I want to see your leg. And then put it up, extend it, and then do it up to your side. And then the other side. Did you do that? Okay. Okay, good. Hip, full range of motion. And then can you go back a little bit so I can see your, and then can you, okay, good. Can you do your ankle? No, lay down, put down. Can I see it? Let me see. Move more. Or you can see it if you want, just do this. Can you put it apart, invert and then invert, okay? And then point and then go up, and then can you do rotate? Okay, ankle, full range of motion. Thank you. And then can you put this way down, and then I want you to flex and extend your knee. Both. Okay, knee, full range of motion. While you're there, I'm gonna do a drawer test. I'm gonna pour you, okay? Okay, no The drawer test negative, anterior drawer test negative. And then while you're here, I'm gonna do the bulge test. I'm gonna push here and then see the fluid wave. No fluid wave. No fluid wave. The bulge test is negative. Okay, now I want you to stand up, and then bend down and touch your knee. Okay, your spine is in midline. Your scapula is symmetrical. Your hip is symmetrical. Okay, get up. Okay, can you do this? And then can you do this? Okay, can you rotate? Full range of motion of spine. I think that conclude my assessment. We'll see. That's it. Goodbye.